Good afternoon, everyone, and welcome. I'm State Senator Judy Ward. I represent 5 very rural counties in South Central Pennsylvania. For the last several years, I have worked with my colleagues on both sides of the aisle, in the House and in the Senate, to get legislation passed that regulates pharmacy benefit managers, or PBMs, in Pennsylvania. I introduced legislation along with Representative Gatos that was recently signed into law to make significant impacts on the cost of prescription drugs for all Pennsylvanians. For the last 10 months, Auditor General DeFoor has been working on an audit that looks at how pharmacy benefit managers operate in the Medicaid system and the Department of Human Services oversight of those benefits. I'm happy and proud to introduce Auditor General DeFoor to share the results of his audit.
Thank you, Senator Ward, and I want to thank you for your leadership on this issue. I also want to thank Representative Gatos, who is also here today. Thank you for leading the charge to make important legislative changes to pharmacy benefit manager operations in Pennsylvania. So thank you for that. Here with me today are Gordon Denlinger, Deputy Auditor General for Audits, and Peggy Morningstar, the team leader on this audit. And we also have Eddie DeCara, pharmacist for Porter Pharmacy. Eddie, thank you for being here as well. Before I get into the details of our audit, I want to talk briefly about how the Medicaid prescription drug system works. Pennsylvanians pay taxes out of each paycheck to provide health benefits to people in our community who are most in need. We do this because it's our legal responsibility, and it is the right thing to do to help our most vulnerable population. People in Medicaid can see a doctor and get the medicine they need to stay healthy and to survive. As taxpayers, we entrust DHS with our money to make sure this happens. DHS contracts with managed care organizations, or MCOs, to provide these health benefits on its behalf. MCOs then contract with pharmacy benefit managers, known as PBMs, to handle the prescription drug benefit. The MCOs and PBMs report back to DHS how many prescriptions were filled and how much it costs to get them into the patient's hands. DHS uses that data to set the rates for future payments to MCOs to continue to run the Medicaid program on its behalf. For the last 10 months, our auditors evaluated how tax dollars were spent to provide prescription drug benefits to Medicaid recipients during 2022. Our objectives were to determine whether DHS effectively monitors PBM's pharmacy claims, including the accuracy of pharmacy information used to prepare the capitation rates for the Health Choices Medicaid program. Determine whether DHS effectively monitors the PBM contracts to ensure compliance and transparency for the Health Choices Medicaid program, and to determine if the PBM PerformRx is following the law for the fees it collects from the pharmacy and the MCO when a prescription is filled. Our auditors found evidence of spread pricing, inadequate monitoring by DHS, and overcharging of taxpayers by PBMs, resulting in the loss of $7 million in taxpayer dollars alone in just 2022. Here's what's happening. The 3 MCOs using PerformRx as its PBM reported to DHS that they weren't charging any additional fees to pharmacies, called pass-through pricing. DHS accepted them at their word, and never verified if this was actually true. Our auditors looked at the MCO and the PBM records submitted to DHS for those claims. These reports indeed showed no additional charges were occurring between the PBM and the pharmacy. Our auditors then asked the pharmacies involved to verify the information. The pharmacy said the reports were wrong. They paid a transmission fee that was never reported by the MCO or PBM. The transmission fee is spread pricing. Spread pricing happens when the PBM charges an insurance plan more for prescription drugs than what is paid to the pharmacy for that medication. The PBM keeps the fee as another revenue source. We found that $7 million in transaction fees were not disclosed by PBMs and MCOs to DHS. DHS then used this inflated data to set the rates it will pay in the future for prescription drugs. As a result, each year DHS is paying more into the Medicaid program than it should for prescription drugs. PBMs like PerformRx are counting on the fact that no one is checking their reporting so they can get paid a higher rate from the MCO and still collect a fee from the pharmacy. During the audit period, PerformRx did disclose to pharmacies that they were charging transmission fees, but failed to tell the MCOs and DHS about this practice, which violates the law. According to PerformRx, they weren't aware that they had to report transmission fees. However, as a direct result of our audit, they revised their reports going back to 2019 and changed their reporting process to report future transmission fees. In its response to the audit, PerformRx acknowledged that it was not disclosing transmission fees to the MCOs and DHS, but it says that these transmission fees are the cost of doing business and not spread pricing. DHS disagreed with most of our findings. They said that they were following the letter of the law and have all the procedures in place to prevent spread pricing from happening. However, after we raised the issues with PerformRx's transmission fees disclosures, DHS resent us data, including $2 million in fees previously not reported to us. When you look at federal law, it says specifically that DHS is responsible for distinguishing how much state money MCOs use to actually pay for benefits versus amounts used to actually pay for administrative services. DHS doesn't validate the information it receives and puts the responsibility on the MCO to make sure the data is correct. And that's pretty risky when billions of taxpayer dollars are at stake. DHS needs to follow federal law and monitor its contractors. PerformRx, the PBM involved in this audit, is one of 4 companies that administer Medicaid prescription drug benefits. In 2022 alone, PerformRx processed 34,346,412 claims and paid pharmacies $1.8 billion for those claims. PerformRx provides services to 3 of the 7 MCOs in the Medicaid program. The same companies that own 2 of the MCOs utilizing PerformRx also own PerformRx. When you have companies that are financially related, legally making money off taxpayers, state oversight even becomes more important. Our auditors made recommendations to DHS and PerformRx to implement changes for accountability and process improvements. But what really needs to happen here are changes in the law. A lot of work has been done to protect Pennsylvanians by Representative Gatos and Senator Ward and their colleagues on both sides of the aisle to implement changes on how PBMs operate in Pennsylvania. Now it is time to focus on the taxpayer-funded Medicaid system. We need to change the law to make sure there is no room for spread pricing to occur with our tax dollars. And the law needs to clearly define that DHS is accountable for the information reported to them by their contractors. This is not just a process issue. Pharmacies are going out of business because of the impact of spread pricing. There were 140 independent pharmacies in small towns, big cities, and suburbs that went out of business in the last 6 months in Pennsylvania. This means that thousands of people on Medicaid have lost access to their medication. Finding another pharmacy isn't easy for someone who doesn't have the transportation or can't afford to travel any further for the medication. And frankly, they shouldn't have to. Spread pricing in any form is hurting the very people we promise to help. It's important to hear how the impacts are being felt right here at home. And for that, I'd like to call on pharmacist Eddie DeCara. Eddie?
Thank you, Auditor General. Thank you, everyone, for being here today and taking interest in this issue. Community pharmacies are struggling. Community pharmacies are not just small, independent businesses and locally owned pharmacies. Community pharmacies are also large chain pharmacies. The reason the term community pharmacies is used is because they serve the community. They employ people in the community. They take care of patients in the community. Approximately 140 community pharmacies have closed since the beginning of the year in Pennsylvania alone. Why are we closing? It's hard to believe, but the majority of prescriptions we dispense, we lose money on. Why is this? It is due to the nature of pharmacy benefit managers, known as PBMs. Community pharmacies are forced to dispense medications below the cost at which we purchase them. It is my belief that PBMs are reimbursing community pharmacies below the cost of medication to profit themselves at the expense of patients and the healthcare system. PBMs administer the pharmacy benefits of the Pennsylvania State Medicaid program. The Pennsylvania State Medicaid program plays a vital role in ensuring less fortunate patients have access to prescription medications and health care. There has been PBM Medicaid reform in various states. Regionally, Ohio and West Virginia have undergone state PBM Medicaid reform. There are reports that suggest that in West Virginia, taxpayers saved $54 million in the first year alone, and the West Virginia economy had an infusion of $122 million, money that had formerly gone to out-of-state pharmacy benefit managers. In Ohio, a state with a comparable population to Pennsylvania, pharmacies were being underpaid by more than $350 million compared to typical market rates. This amounted to pharmacies receiving nearly $9 per prescription less than they should. More studies need to be done, but as you can tell, these are very alarming numbers. This is not only a pharmacy and a state Medicaid issue. This affects everyone in Pennsylvania. Anyone who needs medication, anyone who pays taxes. If you have a child who needs an antibiotic or medicine for an acute need, you go to a community pharmacy. If you have a loved one, a family member, a mother or father who is discharged from the hospital, you need to go to a community pharmacy for medications, not a mail order pharmacy. You don't drive 7 states away to pick up your medication. These issues affect anyone who pay Pennsylvania tax dollars. Less access to prescription medications will result in more hospitalizations. Prescription medications prevent chronic disease, maintain chronic disease, and treat acute conditions. Unnecessary hospitalizations will result. Pennsylvania taxpayers will pay more. If more people who are enrolled in the Pennsylvania State Medicaid program are hospitalized, the bill will go to the state. Who will pay for that bill? But the constituents of Pennsylvania. No business can survive if you sell goods below the cost of what you buy them. It's simple math. Pharmacies will continue to close. Community pharmacies will no longer be here. This is an urgent matter. We don't know if we're going to make it. This is a challenge every day. We need the legislature and the governor's immediate help. We need help now. Fortunately, I live in the 44th district, and our state representative is Valerie Gatos, and she's here today. I've gotten to know Representative Gatos in the last year, and I consider her a friend. We're fortunate in the 44th district to have her representing us, fighting for us, and understanding the dynamics of healthcare. Anyone who does not know Representative Gatos in our district, I can tell you now, she is your friend also. She advocates for you, she represents you, and she's here to help you. So let me introduce to my friend, Representative Valerie Gatos.
Thank you. Thank you, Eddie.
Thank you, Eddie, and thank you for your continued commitment to the health and well-being of our community right here in Moon Township. I also thank the Auditor General for having this engaging oversight of our Pennsylvania Medicaid system through these recent audits of pharmacy benefit managers. And as we've said, those are the middlemen between you and your pharmacist and how your prescriptions are delivered and paid for. Medicaid drug costs are increasing and pharmacy reimbursements are decreasing. And we need to get to the bottom of this. Good government is always about transparency. It's about ensuring that the actions we take are clear and accountable to the taxpayers and in the best interest of the people we serve. In this case, it is about the health and welfare of our citizens and, of course, our community pharmacists, like Porter's right here, who provides a crucial service to our community. And by the way, I'd like to say that it is a pleasure to have an Auditor General who is actually an auditor. So it's very helpful. So thank you, Auditor General. The bottom line here is that the people have a right to know how much and what government does to spend their money and to hold pharmacy benefit managers accountable to ensure that consumers get what they need. There's absolutely no reason that the taxpayers should be overcharged. And this is what this is about. The law says that these audits are intended to make DHS and government aware of their responsibilities. And that's exactly what we are doing here today. Certainly appreciating the Auditor General for taking that seriously. I'm pleased that during this exemplifies the kind of government action that truly makes a difference in people's lives. By focusing and aiding citizens and communities, we are ensuring that government assistance is applied where it is most needed. So as we move forward, these audits, this assures transparency, fairness, and accessibility of healthcare for all Pennsylvanians. Thank you, and now I'd like to turn the podium back over to the Auditor General. Thank you.
Thank you.
Here's a question. Yeah.
I'm sorry.
Could you, talking about the amount of money, I guess, that was not spent appropriately or taken from taxpayers in 2022, how does that reflect on what you could estimate for 2023? And is there a way to fix what was done, make up for that? Does that make sense?
Yeah, as far as getting, are you talking about recouping the funds? Right, the money's spent, so there's no way of recouping it. But as far as the other part of your question, I'm going to let Peggy Morningstar, the auditor on this audit, handle that.
Sorry. So the audit period was 2022, and we looked at 2022, and we aren't projecting forward, but it is an issue for 2022 that they did not report the fees. And like the general said, the Perform RX did go back till 2019 to fix all their reports, which means it was definitely a problem for those 5 years.
So DHS is saying that spread pricing has been banned with Medicaid claims since 2019. So are you saying in your report that that's not the case, that the spread pricing is happening, or are you just broadening the definition of spread pricing to include transmission fees?
When you talk about transmission fee is spread pricing. And I'm also going to bring back Peggy to finish answering that question, but the spread pricing, the transmission fee is spread pricing.
So yes, you're correct. Act 120 of 2020 put a prohibition on differentials between what the MCO pays the PBM and what the PBM pays the pharmacy. However, it left a loophole that allows transmission fees if they're one, disclosed, and two, done at payment. That is the spread pricing. It's a difference, whether you call it a transmission fee or a rebate or a discount, it's spread pricing.
You're saying, sorry, I'm still not grasping. So they're saying what's paid to the MCO is the same as what is going to the pharmacy and that they have the transparency they can see on both sides. And so you're saying even if that number is the same, by adding this fee, they're still hitting the pharmacies in the end.
So the MCO, let me give you an example. Maybe that would help. A member comes into a pharmacy to pick up a drug. The pharmacist goes through the claims processing, and it's instantaneously that day for the member to get their drug on approval. The pharmacist then puts through the claim information to the pharmacy benefit manager, who then requests payment from the MCO. Let's say it's $10. Now, that $10 includes dispensing fees, co-pays, and the cost of the drug. So that $10 comes back to the pharmacy benefit manager. They then deduct the fee of, let's say, $1 and give the pharmacist $9. The spread is the $1 because the MCO paid 10, the PBM paid 9. Is that
Clear as a bell.
yeah?
I think $1 is very generous. More like they take 9, you give us 1.
But the main thing about all this is it's just one word: transparency. They weren't transparent, and that's where the issue lies. If you're being transparent, you may not necessarily like fees, but at least you're upfront and reporting the fees. They weren't.
Do you think this is going to encourage more action with legislation? I know Rep. Gato's and Benham's bill was trying to push for a ban on spread pricing since everyone agrees they don't like it, but you couldn't get that through, at least that spread pricing part. So now that we've all agreed, do you think that that's going to be able to help future legislation? Can you visit that?
Well, as you can see, this is a whole complicated pricing scheme. And what this is doing is, again, transparency to try to chip away to understand how your government dollars are being spent. And it is confusing. It is complicated. And what we're trying to do here is simplify it so that the taxpayers understand what's going on.
Any other questions?
All right, well, thank you all for being here.